Hey everyone, welcome back. It's Chris with NeuroDX. I'm going to bring you a advanced case here. This is on the NeuroDX app. I'm going to ask for help. I'm going to use all the tools and I'll show you how it works. So first thing, I asked for an advanced case, just like I said. So setting is Mr. Raj, a 62-year-old Indian man. The doctor of a strange episode staring blankly at the wall with a TV for minutes at a time. Not present and scary. Okay, so take those into account. Happening for about 2 months now, maybe more. It's hard to say. And then, of course, we get some non-verbal cues, as usual. Mr. Raj is anxious, wringing his hands, gazes distant. So that's all good to know. Pauses frequently, struggling to articulate, so maybe some motor issues there. So looking at Mr. Raj's case here, remember that each piece of this has hints and clues about what the hidden diagnosis is in the background. So although you don't know what that diagnosis is, the system does. And we're going to talk to Mr. Raj and see if we can find out some information about what's going on. It's important how you talk to the client. It changes the way that they interact and they respond, and they can open up with more information if you treat them better. So it's always best to treat them more human. So I want to know about the staring episodes. I want to understand what they're like and how they're feeling. So I'm going to ask him if he can describe that for me. So he's essentially there but not there, can respond. I can't respond, can't move, can't speak, but I can hear everything and see everything. So that's incredibly interesting to me. So I'm going to put that in my notes over here. It's like I'm trapped inside my own body, an observer. It's terrifying. That does sound quite scary. So that's our natural response, right? So we want to affirm that. We want to let him know that we're here with him and listening. And then when it's over, I don't remember what happened during that time. It's like I've lost a chunk of time, a few seconds to a couple of minutes, I think. It's kind of, I don't know what's happening. So, and then I don't remember. So here I'm asking him to describe more about the environment and the events that are going on. And of course, affirming that it does sound scary. In a contextual environment, there's not really randomness. So there's triggers going on here. There's something going on either internally or externally. Like he said, I'm more stressed or tired, but he can't be sure. He's not the one who knows what's going on, but realistically, there is a cascade of experiences that is triggering this event. And so, that's what we're trying to understand. So I can tell him that. I don't know if he'll care about that, but I'm gonna let him know. And this is something that I've had to do in my life. I've had to do with my wife, and moments when you can't find a pattern, you want to write down what you're doing when something's happening, how you're feeling, and all of those experiences, so that you can work towards finding a warning sign, because there is going to be one, there are going to be triggers, there are going to be patterns. He just might not know them yet. So I'm going to ask him about disease or dysfunction in the family and whether there's other ailments being treated as well. So let him know that things aren't random so that he can start keeping track, and then we can start understanding. Family history, Parkinson's disease in his later years, but I don't think that's related. As for me, I've been diagnosed with hypertension, I take medication. Bit overweight, trying to manage diet, that's fine. Also seeing a therapist for anxiety. Okay. So I'm going to take down father's Parkinson's in later years. It doesn't, I can ask him about like handshaking and stuff next, because I don't think that it seems like Parkinson's. Something I also want to see if they have anxiety, which, he's embarrassed about. Lots of people are embarrassed about seeing therapists, but it's really important. So it's worse since these episodes started. I'm worried it might be related. I don't want to jump to conclusions. So always, answer the questions. Anxiety is getting worse. It can certainly have an impact on the presentation of symptoms and your experience. Do you think these things could be linked? So that's, answer his question. I'm very curious about how the anxiety interacts. This is recognizing that anxiety comes in many different ways and it experiences differently depending on who you are and what you're anxious about. Yeah, so this is definitely a chronic anxiety issue to some extent. Like, it's definitely being exacerbated by his chronic anxiety. And it sounds like it's a lot. So this is something I have from personal experience. It's a lot of the way that my anxiety manifests. Sounds like you're overwhelmed, hard to live with the uncertainty underlying everything, and asking whether they feel paralyzed. Because remember, the paralysis is going to prevent him from moving, and that can cause dissociative episodes. I don't want to move, don't want to do anything. I'm just stuck alone with fear. Okay. So it sounds like his mind is racing before these episodes. This sounds like a dissociative disorder. I'm not going to instantly say that. It sounds like a dissociative disorder stemming from severe anxiety with a root cause of trauma. I'm thinking about referring you to a trauma therapist and service called No More Anxiety. It works specifically with you on these things. So before we move on though, I want to get a physical examination done just to rule out the Parkinson's and everything. Let's say tests complete. Results. Here we're looking at tests that we would expect. This is one of the learning scenarios and one of the learning dynamics within NeuroDX to teach you, what is the proper process and how do we rule out certain things. So EEGs or MRIs we can do. So if you see at the end, it says, would you like to lock in your diagnosis and treatment plan, or do you need more information? At this time, I feel comfortable, then would like a full solution. So full solution is going to give me the entire breakdown of what was going on in this case, including red herrings and all that. Great work. Here's a complex partial seizure. So I wasn't right. Let's try a type of focal seizure that originates in one area of the brain. Seizures often cause a blank stare, slight twitching, and a lack of response. So I wasn't, 100% off. This is a complex, intertwined issue that will require an integrative, holistic treatment approach. But this should be coupled with neurological treatment for seizures. So I should have been able to look for seizures. Now I can ask reflective questions. So I can say, let's reflect. Firstly, you approached it with a holistic mindset, right? His physical symptoms could not be separated from his emotional. So let's answer number 5. Question number 5 here. And I said I would focus more on the presentation of the experience and consider seizures as a potential factor enabling us to prescribe anti-seizure medications if tests came back showing it was, which they would have. Then we can ask full review. Then you get, that nice full review of what was going on with Mr. Raj, what we did well, and where we go from here. So for this case, I still have 6 of 20 interactions, which means I can go in and learn more still within this chat. So if I identify detailed physical examination, such as EEG or MRI, so I can literally ask, what would I be looking for in these, and how would I know? So imagine you're studying this in school, and you want to understand what you'd be looking for in this detailed examination. Muscle strength, reflexes, sensation, eye movement, speech coordination. There's a whole process. Tells you what EEG is, tells you abnormal electrical patterns, focal partial seizures, the abnormal electrical activity seen in just one area of the brain. If you have seizures during the EEG, you pick up on this. So you might even have one of those long-term EEGs, so that you can catch it, so you can catch a seizure when it's happening. This is also really important. A negative result doesn't necessarily rule out a neurological condition. A positive result does not necessarily confirm one. And you're getting a notification here that you should be requesting feedback and learning. That's where we're at right now. And you're at 15 of 20. So we can ask another question. So EEG, how would we catch the seizure? Get lucky. So maybe it'll tell us here if there are those long-term, like 2-day, 3-day. Oh, here it is, exactly. There are ways to increase the likelihood of recording a seizure. Prolonged EEG monitoring. Sleep diversion can trigger seizures. A patient. He did mention, remember, he did mention sleep deprived or being tired and overwhelmed can cause his issues to worsen. So that's also something that we can look for when we go back through the next time that we see a case like this. So anything else I should know for the future? We're coming up on our last interactions here. This is just some general information. Okay. So that's basically the whole process. That's one case. Now we can go and download the case, pop open this file, and you'll have everything that we did. Patient, doctor. This is just the entire conversation. If you want to name it something, you can. You can also go and download your notes so that you can put them in the same place. And then I'm just going to show you the cheat sheet here. That's an advanced case through NeuroDX. Thank you guys for watching, and if you have more interest, I would love to post more of these. Any questions, things you thought I should have said, things that you thought the bot should respond to in a different way, just let me know down in the comments, and I'd be happy to talk about them, and might even adjust the system to support your piece. So thanks so much, and have a good one. Bye, guys.